Hi, welcome back to DKMS's YouTube channel. Here, we talk about everything under the umbrella of blood cancer and what you can do to help. In our previous video, we spoke about a type of blood disorder, thalassemia. Today, we're going to deconstruct the next type, known as sickle cell anemia. Sickle cell anemia is one of the groups of disorders known as sickle cell disease. This is an inherited red blood cell disorder in which there aren't enough healthy red blood cells to carry oxygen throughout your body. Normally, red blood cells are round and flexible and can move easily through the blood vessels. In sickle cell anemia, the red blood cells are shaped like sickles or crescent moons. These rigid sickle-shaped cells can get stuck in small blood vessels, causing the blood flow and oxygen to parts of the body to slow down or get blocked. Hemoglobin is a protein in red blood cells that carries oxygen throughout the body. People who have sickle cell disease have abnormal hemoglobin in their red blood cells, where they inherit two abnormal hemoglobin genes, one from each parent. The types of sickle cell disease are hemoglobin S beta 0 thalassemia, hemoglobin S beta plus thalassemia, hemoglobin SC, hemoglobin SD, hemoglobin SE, and hemoglobin SS. In all types of sickle cell disease, at least one of the two abnormal genes causes a person's body to make hemoglobin S. When a person has two hemoglobin S genes, the disease is called sickle cell anemia. This is the most common and often most severe type of sickle cell disease. Hemoglobin SC disease and hemoglobin S beta thalassemia are two other common types of sickle cell disease. Hemoglobin SD and hemoglobin SE are much less common. Symptoms of sickle cell anemia usually appear around 5 months of age. They vary from person to person and can even change over time. Some symptoms include periods of pain that can last a few hours to a few days, blood clots, swelling in hands and feet, joint pain that resemble arthritis, chronic neuropathic pain, life-threatening infections, and anemia. A blood test can check for the defective form of hemoglobin that underlies sickle cell anemia. If you or your child has sickle cell anemia, your doctor might suggest additional screening tests to check for further complications of the disease. Treatment of sickle cell anemia is usually aimed at avoiding pain episodes, relieving symptoms, and preventing further complications. The treatments might include medications and blood transfusions. Currently, a blood and bone marrow transplant is the only cure for some patients who have sickle cell disease. We hope you enjoyed and learned something new from this episode of Deconstructing Blood Diseases. Do you want to become a potential lifesaver? Visit our website and register with us today. Don't forget to like, share, and subscribe to our channel for more informational content. Join us in our journey and follow our social media channels mentioned in the description below. Until next time.